welcome to Breaking the Silence podcast with your host Victor Company. As usual, we always talk about the issue which affects the life of the people, and almost it's about the health issues. So don't forget to subscribe, share, and like. So I'm not alone in this podcast. I'm with the gentleman here, and we're going to talk about the issue of the population and health. How the population is being determined in any ways, about the health. So, population now is growing. So, there is any change on health considering population. So, we have the minister, and you're going to talk about that topic in detail. So, don't leave me alone. Stick around. So, doctor, can you tell the people on what do we mean by we say population in health context?
Okay, population in a health context.
Yeah.
This can refer to group of people or
Yeah.
group of individuals
Yeah.
within a specific geographic area
Mm.
who are sharing similar characteristics or characters such as water, age, as well as health status.
Yeah.
And not only, but also this can include at local population or at local level,
Yeah.
national level, as well as specific subgroups like the elderly,
Yeah.
children,
Yeah.
as well as the disabilities.
Yeah.
So if we say population in a health context,
Yeah.
that's what it meant.
Yeah. Okay, fine. That means all the things that you have mentioned, how they create a compound on population.
Yeah, that's it.
So, according to our section we are going through, can you tell the people how does the population size affect the access to health care in our local community, even the national level, even in the society we are living?
Yeah, okay. As you know nowadays, not only nowadays, but the way of life,
Yeah.
you only live we live a dualistic life.
Yeah.
I mean, we live at pair life.
Yeah.
Maybe like the advantages and disadvantages.
Yeah, indeed.
But this issue concerning about population in health context,
Yeah.
let's move from fewer people, because normally we are talking about people.
Yeah, yeah, a lot of people, the huge people.
So let's focus much on more people.
Yeah.
High population,
Yeah.
maybe more people will have population. The same. More high population has impact affect population, affect
Health of the people in
health
the
of the
community.
people. Like for example,
Yeah.
in local communities, we have local clinics.
Yeah.
Normally there are more people competing for fewer resources at the
Yeah,
hospitals.
they need the medication.
They need medications. So if people are more, they cannot all access the
The facilities which is required.
sure. So
Yeah.
the hospital or the clinic can only manage to help a few,
Yeah.
leaving more aside without help, because they have limited access to resources
Yeah.
and people
Yeah.
wanting them. So
Yeah, that means the duty of that facilities is for government or even the country. So I would like you to tell the people, why is population health an important area for government and public health organization to consider on that thing?
yeah, it's important, or it's vital, because if the clinic or if the hospital manage to help a few, and others unhelped, so those unhelped have life to live.
Yeah, indeed.
So if they are not helped at the clinic or at the hospital, they're gonna die.
Yeah,
So
or get paralyzed. Indeed.
So it's the government's responsibility to focus much on this population,
Yeah.
so that maybe they can focus buying more resources,
Yeah.
to these clinics, for clinics to be able to handle more people, for the clinics to handle more people, so that people come and help
Yeah, in time, indeed.
in time,
Yeah,
without
for
losing a life. because every life matters, you know.
Yeah. Don't take life for granted, because this is only one gift which people can be given at the one time.
And also, you know, economically,
Yeah.
uh, government is the government responsibility to sensitize people
Yeah.
on the impact of having more population in an area.
Yeah, indeed.
And government responsibility can be giving practical examples.
Yeah, indeed.
For example, I've seen impact of
Even in
population.
Zimba or nothing where the thing is happening which is not good.
Yeah, they can be using that scenarios to sensitize people to the impact of what on higher population.
Yeah, on the health of our
On the
activity.
context. Yeah.
Yeah. So this issue of population and health, we can say people can meet with the different challenges and the struggles which can affect the health of a person. So can you tell the people what happened to the health system when the population grows up mainly too quickly? If in the country the population is growing too quickly per year, for instance, we have the millions of people in this country as in Malawi. So if the Malawi population is growing too quickly, what can be the impact on the system of the health or financial concerning on the health to the government?
Yeah. First of all, people must know that who are they growing, not these facilities like hospitals.
Yeah.
Only people is growing.
Yeah.
Only people's
Needs, or when they wanted to get something from the government, especially for instance ARVs, when they get sick, get HIV, they need those things.
Yeah. And the secondary, we can say that overcrowding
Yeah.
in hospitals. For example, here at Malawi, we have specific time for closing our services like hospitals.
Yeah.
We only close at 3 o'clock p.m.
Yeah.
So it's no matter if there are more people on the line wanting hospital services, but if time is going to close, we close.
Yeah, indeed, they close.
This is because why more people on the line without any help? Because there are more people, small hospital.
Yeah.
You know, so that's
Yeah.
it.
Yeah, you have really been on that thing. I went in Zomba. I found the alien sitting clinic. There was a lot of people. Most of them were elders and under 5 children.
Yeah.
So the thing was at the time when it was at lunch time, all the people who are assistants, the nurses, were going to the lunch, and the people were left there without it being given the enough treatment. So my question was, if there would be how the more facilities, even the more hospitals in Malawi, these people can be helped in time and they can get well soon. That means if the population, if it is going up every day quickly, we can face these changes. And if these changes are happening, we should not even why this thing is happening.
Yeah, it's normal. It's normal because only population is growing, but you know our national economy doesn't suit us or allow us to build more hospital facilities.
Yeah.
You know, so same facilities, but the people are increasing every day, consuming those small facilities.
Yeah.
Yeah.
Okay, fine. You have talked about the issues of the hospital. So, population only health. We are not talking about the hospitals. So, how does this overpopulation put pressure on water, sanitation, and food security in our localities?
So you know, let's talk about water and population first.
Yeah.
You know, water is essential for a human life.
Yeah, indeed.
So high population leads to overcrowding. And we have waterborne diseases that
Yeah.
that can be caused from overcrowding. So
Yeah.
where can people go? For example, we have only one river or only one dam in the community, and due to higher population, people have nowhere to pit to pit their trains.
Yeah.
For waste, maybe for to pit for drums, no, for bins,
Yeah.
for throwing, for disposing waste,
Yeah.
and they are only wasting it, disposing it in the river.
Yeah.
and
Anywhere.
they were
They can get affected as such. That means that there is no hygiene.
Sure.
As is result, every time there is this, which is fry and other vectors which can brings about the diseases. As a result, people can get sick of cholera, diarrhea, and other diseases.
as you can see, that's a population versus water. Higher population leading to waterborne diseases affecting people. And more cases of overcrowding in hospitals. Already we have small hospitals, and others are dying because they are not helped fully in the hospitals, because we have also limited resources.
Yeah, we have seen now in localities, for instance, when you visit a certain borehole, you see in a queue, like people, they wanted to get something which is unique, like a silver, even a gold, but they want water. So you see the queue, there is a line, a long line. The people, what they want, it's only water, and they sell any borehole, which is not good. As a result, the people can not get the enough water for their daily life.
And also, for example, recently we have faced this pandemic called the coronavirus.
Yeah.
And also cholera. It is spread fast.
Yeah.
When maybe it's prone to spread when people at the areas where there is more people. So if one is affected,
due to the overcrowding, they can spread easier to other people. Hence, more people in the society or our localities can get all the people being affected with that disease.
so
Yeah, that's it. So you have talking about the water and how people can compete due to the overcrowding. So you know, we have the families indeed. Assuming we have 3 or 4 children at our home. So assuming we get only the food which is applicable or which can be provided for the 2 children. What if a family have a large number of people and they get insufficient food? Do you think this overcrowding, or we can say overpopulation, can affect health on context here of food security in a family?
yeah, that's it. And it's directly involved, you know.
Yeah.
Let's take it for example. At the village, maybe your chief gave you the land to plant your maize.
Yeah, to cultivate
maize, and you cultivate it and you harvested maybe 2 bags.
Yeah.
2 bags, but you have 4 children at home.
It's not enough for a year,
Yeah.
for example.
And also, you are never alone facing that situation.
Yeah.
More families are facing the same situation.
Yeah, indeed. We have
And
seen.
there is one government maybe watching for suburbs like we say Makoponi.
Yeah.
Like free maize from government, and government cannot manage to give us
All the people who are ragging on that weird thing.
and that you consume your 2 bags of food maybe for 2 weeks. The rest you suffering. Hence malnutrition for the children.
Yeah.
Why you are more in your family, but you have
Insufficient
food.
Yeah.
You know, that's it. So it's a matter of drawing modern using these are maybe contraceptives
Yeah.
to avoid such behavior or such cases.
So you now have telling the people to avoid this population and how they impact on health. People should get this family planning method.
Yeah, that's it.
This is the way we are doing our podcast. Don't forget to subscribe and comment. As the way we move on, we have talking about the challenges, impact, and even the things which people get suffered because of overcrowding. So, can you talk about, for instance, if the people population, I mean, if it is growing rapidly, do you think what are some of the diseases can come easier and spread fast because people they are crowding due to the quick I mean, we can say the quick spreading of the people as the population is increasing rapidly every day.
Yeah, that's a great question, and I hope currently we've known that before we have diseases like coronavirus,
Yeah,
coronavirus and cholera. It's rapidly spreading because of high population, you know. And if one maybe in a community, if one is affected by cholera, it's prone to transmit it to what
the rest of the people in the society.
yeah, you know, because
If the same person will visit other people at the a certain meeting, even if the chief invites them, they can be
transmitted to them, you know. And also as the coronavirus, the same can happen. And it is spread fast when there is overcrowding,
yeah.
because it's an air, it's traveled by air. So take it as check, for example,
Yeah,
at the market,
yeah,
we are more people at the market, and more people at the market, but same air. So one is affected by coronavirus when breathing out.
and breathing in.
Same another person takes take that breathed out air and breathe it in. So this virus comes from me to the other, you know.
So, what are some of the diseases that people can get because of growing of the population rapidly?
Commonly, we have this cholera,
Yeah,
and cholera. This virus is a coronavirus,
yeah,
and you also have we normally call it in our local language impere,
yeah, I'm here.
and also we have what we call trachoma,
Yeah,
etc.
yeah. So, you have mentioned about the cholera. So, how overcrowding or rapid population can be facilitated with the cholera? And I want you to say more. Because when you say that cholera can be caused due to the overcrowding or even the population is growing rapidly, can you tell the people how does this occur?
Yeah, that's great. For example, let, let me take this practically.
Yeah,
I need two thousand
yeah,
at a certain village in Blantyre and Bayani. We only registered one case cholera first,
yeah.
and
So, doctor, can you tell the people how does the education plays or what role does the education play to improve the population? Both we talk about the population and the health issues.
yeah, actually,
Yeah,
education is playing a large role in sensitizing people about the dangers of increase in population.
yeah,
You know, they've introduced syllabuses for people, maybe syllabuses like our children are learning maybe contraceptive ways.
yeah. In primaries we have that, secondaries people.
Or even in secondaries they are learning it. And the impact of increase in population.
Yeah,
And also these educators, they are they are sensitizing their people on the they are sensitizing their people on the impact of increasing population,
Yeah.
and also they are advocating policies for change.
Yeah, indeed.
For change our traditional ways, because to say the truth,
Yeah.
the other impact of this population drop is for others consider it as culture.
Yeah, indeed.
So these educators, they are advocating it for, they are advocating for policy change,
Yeah.
for to change the mindset of what for people, and
Agree. So we have talked a lot on population and health, and almost on the challenges, on how people, how they have been affected due to the overcrowding or even the over rapid population in our country. So this is our maxim. But before we leave, I just want you to tell the people almost a certain piece of advice concerning on our topic, especially how population and health, why people should take this thing as a serious issue in everyday life.
yeah, it's necessary to consider this topic.
Yeah.
My advice is people let's observe social isolation. If one is affected, call immediately health
Assistance.
assistance.
Yeah.
Okay, let's invest in this is going to the government. Please invest more in health care facilities.
Yeah.
People are dying. Sensitize people. Workforce.
Only the issues of health.
Health population. That's what I can say for.
This is the way we are doing with our podcast, breaking the silence on your health. So don't forget, as we have said already, to subscribe, comment, and like. We are going to meet in the next episode where we're going to talk another topic. Stick around.